Katy Kamkar for a look at what appears to be a growing issue and how we can help kids take control of their worries. Obviously, there's this just inherent stress of going back to school.
Yeah.
What are some of the things that parents and students should be looking out for?
Yes, and you're so right? We often hear of the anxiety and the worries and the heightened stress that kids experience, but then also the parents as well, and rightfully so, because we always have to kind of adjust again a life schedule, work schedule, and then also a lot of times we hear parents mentioning their own anxiety when they themselves had to go back to school as well. It's very important here to things that are helpful is always planning ahead of time. It's always very helpful planning ahead of time in terms of being ready when it comes to school items, when it comes to, locations and work-life, balance and scheduling and so on. The other thing is really normalizing the anxiety as well. It could be also associated with a lot of other symptoms. It could be changes in our appetite, changes in our sleep, not wanting to engage in our activities. And so it's important to normalize those kind of reactions, but nevertheless not to forget our self-care and definitely working on our routine and structure.
All right, so when you look at routine and structure, what are some of the things that should be in there?
Well, definitely as we just talked about, planning ahead of time in terms of what are the things, the elements that I need, the items that I need, but then also in terms of parents is always very helpful to know in terms of, children's schedule, school scheduling time, what are the items that we need for school, scheduling in terms of, our employment and work-related matters, all those kind of nitty-gritty, but then of course always reminding ourselves that we have also done it in the previous years. And after 2-3 weeks, everything hopefully again gets back to normal and we become used to it.
What are some of the signs that maybe your kids aren't getting back to normal and it's time to get professional help?
Thank you for asking this question, because we know that 70% of mental health problems do onset in, in childhood and adolescence. And a lot of times we know that our youth struggle, and it's really within the young adult age when we see that the symptoms become more severe or interfere with their functioning that then they seek help. Certainly if we see that there's sudden changes in mood, feeling anxious, feeling down, blue, depressed, not wanting to engage in our routine, not wanting to go out, any changing kind of behaviors, let's say, not wanting to do homework, not wanting to go to school, not wanting to play anymore, with our peers, and also in terms of changes in sleep, appetite, concentration, bad dreams. And of course, if the symptoms increase over time and interfere, as we just talked about, with day-to-day activities and responsibilities, it's very important to seek support, to seek help, and definitely professional help.
We always talk about the stigma associated with mental health. For students, is it even a bigger issue to deal with, the stigma? Are we making progress as far as people admitting that, hey, I need some help?
Exactly, right, that hey, we need some help. Yes, progress has been made, thankfully, and we have noted the stigma reduction, certainly in the past 2 to 5 years. Definitely further room, there is a room for further improvement. And just by, what we're doing right now, normalizing the conversation, the talk around it, then it's important for people to know that they are not alone, that they can seek help. And yes, indeed, we do have effective treatment available.
Is there a treatment available in schools as well? Because a lot of times kids, they don't even talk to their parents as much in those years, in their teens.
We know sometimes we do notice that, right? That it's sometimes more comfortable, especially for them, to talk to a stranger as opposed to, let's say, to their parents. I would definitely see, different schools have different programs. Certainly, we know that a lot of schools do have their own counselor or psychologist. I would definitely orient in terms of, just as we all do with any organization, institutions, and school, what are the programs available? It's very important to seek out and help available.
Dr. Katy Kamkar, thank you so much for your insight and some great tips as well. We appreciate it.